Hi, I'm Marta Benavides. It's time for Socialife. Coming up on this edition of Socialife, an important step in the fight against COVID-19. Hear how this top researcher is coming together with colleagues to help the most vulnerable patients get through this pandemic. We're going to share his message of hope. Giving children with disabilities the tools to have a fun and safe summer. We are getting to know a foundation devoted to doing just that. Plus, a way to spice up summer with a little help from our friends at Santa Fe Steakhouse. Stay with us. More Socialife right after this.
Healthcare is being challenged. DHR Health is meeting that challenge by providing the highest standards of care and safety, caring for our patients, and caring for our community. We're bringing the vast resources of DHR Health's medical campus, its 740 doctors, 5,500 employees, and over 70 satellite clinics in a coordinated effort to fight the spread of the coronavirus in our area. Now more than ever, DHR Health, for you, for life.
Rio Bank would like to take this opportunity to tip our hats to all the hard-working folks in the farming and ranching business. Your jobs can be really tough, but getting an ag loan shouldn't be. Rio Bank offers agriculture loans that are here to help you make your job a little easier. From farmland to cattle, we've got your back. Come speak to a Rio Bank representative today to get the ag loan you need to keep growing.
Rio Bank, your kind of bank, your kind of banker.
Hi, I'm Rabbi Farb, the new rabbi at Temple Emanuel. In Judaism, we are taught to say 100 blessings every day. When things are going great, it's easy to find 100 reasons to bless, but even when times are hard, we are blessed in so many ways. When you can't find toilet paper, it's easy to forget that others have lost their job. When you're out of work, it's easy to forget that others are sick. But if we all pull together, we can keep people healthier, return to work, and we'll even have plenty of toilet paper. Start by counting 100 blessings in your life today. Thanks, Martha.
We'd like to welcome you to the Valley, Rabbi Nathan Farb. Thank you so much for your message of unity. Coming together to offer hope and healing to those having a difficult time recovering from COVID-19. We'd like to welcome our friend, Dr. Sohail Rao. He is the President of Research and Development with DHR Health Institute to talk about a very important life-saving mission. We want to welcome you, Dr. Rao, to the program. Thank you so much for your time.
My pleasure. Good afternoon.
How are you?
I'm doing great. Thank you very much for asking.
Wonderful, wonderful to have you here with us. We want to start with antibody testing and why this is such a crucial step in helping those having a difficult time fighting COVID-19. Would you elaborate?
Yes, so as you know, there has been a recent increase in COVID infection in the Valley. And this has potential to overwhelm our healthcare system. At the present time, no drug has been approved by the FDA, which is effective in treating COVID-19. And therefore, the only alternative that we have at the present time is to treat these patients with plasma obtained from those who have recovered from COVID-19 infection.
Once you've been tested positive and you've recovered, how much time must one wait before they are able to actually donate their plasma, Dr. Rao?
Okay, so there are a few things that we have to keep in mind. One is that the person has to be diagnosed previously using nasopharyngeal swab or RT-PCR that they did have COVID-19. Once that happens, from that day or from the day of the start of their symptoms, which are usually 4 or 5 days earlier, we have to wait 28 days before we can actually do plasmapheresis or obtain plasma from those patients.
So 28 days. Can you walk us through the process? How safe is it? And from start to finish, how much time? Can you walk us through that process, please?
Yes, so it is, as you are very well aware, plasma donation is a standard procedure. Millions of such procedures are done on a daily basis in North America and here in the Valley. So once a person calls us and we identify that they are a potential donor. We bring them into our clinical research, clinical trials unit to collect a little bit of blood. And the purpose of doing that is to ensure that they have indeed developed antibodies against the virus. Once that happens, within the next 24 hours, we will get the results and we will call them back and share those results with them. If they are potential donors and if they do have antibodies, then we ask them to go to one of our plasma donation sites here in McAllen and in Harlingen. And this morning we discussed it with Vitalant, our blood bank partner. We will be opening up clinics in Brownsville also to donate plasma. And so once they go there, the process is pretty simple. It's actually a 45-minute to 60-minute process. They basically put, as if you're getting an IV transfusion, to put in a cannula, a catheter, and they start drawing blood. The liquid portion of the blood is actually retained. The cell portion of the blood is put back into the patient. It's very safe. It's a closed system. It is done in a very aesthetic environment so that there is no contamination.
Would you be so kind to explain in the most simplest terms, Dr. Rao, for anybody that's not quite sure how antibodies can serve others with their fight against COVID-19? Can you talk about how powerful these proteins are for someone that's having difficulty recovering from this virus?
So when a patient gets infected with this particular virus, their immune system actually starts to develop protective responses, essentially to destroy the virus. In that process, there are proteins called antibodies, which are also called immunoglobulins, are produced. They bind to the virus and eliminate it from the body. Now, early in the infection process, the immune system produces antibodies, which are called immunoglobulin M, and later on, within 10 to 14 days after infection, it produces immunoglobulin G. It is the immunoglobulin G which is actually the most effective in destroying the virus. And it is also the one for which we currently have testing mechanisms available. Now, plasma, which is the liquid portion of the blood from patients who have recovered from COVID-19, that's what is called convalescent plasma. And there has been enough evidence now that by boosting the ability to fight infection, a transfusion of convalescent plasma, which contains these antibodies, can benefit the patients who are suffering from severe and life-threatening COVID-19. At the same time, transfusion of plasma can also help manage some chronic diseases, because patients who have other medical conditions such as heart disease and diabetes, or have weakened immune system, by giving them passive immunity, by infusing antibodies from patients who have recovered from COVID-19, actually helps those patients recover better.
Can sharing these antibodies harm someone, like keep someone from fighting COVID-19 if they fall victim to it again? Does it hurt their chances, I guess, is what I'm trying to ask.
So the immune system is pretty resilient in a sense that once you donate, first of all, you have that surplus of these antibodies in any circumstance. Mm-hmm. And secondly, donating these antibodies, your immune system within the next 24 to 48 hours recovers whatever antibodies that you have actually donated. To the extent that CDC has recommended that individuals who have recovered from COVID-19 infection can actually redonate or donate again plasma after 7 days. So this is how fast the recovery takes place. So the person who's actually donating plasma is under no threat of actually exacerbating their condition or getting reinfected.
Where can one call to get more information, to go through this testing? Where can one call for that information?
So I wanted to make sure that the community here understand that this is not an initiative that only is limited to DHR Health. We at the present time actually have 9 hospital systems that are involved. We just added 3 more yesterday in this consortium. So it is across the entire valley from Hidalgo to Cameron County. Anyone who's interested, who has been previously had a positive COVID-19 test, they can call us on 956-215-3166, or they can call me directly on my cell phone, 504-444-2318, for us to have a conversation with them about if they actually are a potential donor. At the present time, I request through your program that we are badly in need of a blood donation in blood group O.
Okay.
That is the predominant blood group in North America. It's actually a predominant blood group here in the Valley, and we are in bad need of actually getting blood group O at the present time.
These plasma donations, Dr. Rao, do the donations stay here in the Valley?
Yes. All of the donations that are given by community here in the Valley stay in the Valley. However, having said that, we do get a lot of donation from other centers in the United States which have surplus. In fact, in the last couple of weeks, we have received almost close to 160 units of plasma from our partners in other part of the country. But the answer to your question is yes, whatever we donate here stays here.
Well, we know the cases are going up. This virus is not getting tired of us, unfortunately. What is your message in advance of this holiday weekend, this 4th of July weekend? What is your message to those on how we can do our part, Dr. Rao?
Well, very simple. You've heard this so many times, and it has people. There are simple steps for people to follow. Wear the mask, maintain social distance, and wash your hands as many times as possible. Try not to congregate in any setting where it is more than 5 to 10 people in a closed room. Try to maintain. These are very basic steps that you can take, which are actually going to flatten the curve and maybe even bring it down eventually.
Well, we're so happy to bring your message to our Socialife family, and I think on behalf of our community and on behalf of our Socialife family, I want to say thank you for being on the front lines of our healthcare system, for the work that you do, and I believe that is so deserving of a Socialife toast. Would you like to grab your mug? Thank you so much. Cheers.
Thank you very much.
We appreciate it. Salud.
Thank you.
Thank you, Dr. Rao.
Thank you very much. You take care.
Likewise. And coming up, how to make summer brighter for children living with special needs right here in the Valley. Don't go away.
There is a place where the Republic lives on. It's in our unique Southwest cuisine, in our drinks, and our live entertainment. Come enjoy our historic ambiance and inviting staff, where the legacy of the Republic lives on. Join the revolution at the Republic of the Rio Grande.
We give 100%. We do whatever it takes. We sweat the small stuff. Every day, every hour, for 20 years. To ensure that every child in every community we serve has a chance to succeed, compete, thrive.
This This pandemic has presented many challenges for all of us, and for the families of children living with disabilities, that set of challenges has been amplified. And that is the reason why the Capable Kids Foundation exists. It is a foundation that serves those families. And joining us right now is Miss Melanie Watson. She is the president of the board of directors for the Capable Kids Foundation. We would like to welcome you to Social Life. Thank you so much for joining us, Miss Watson.
Thank you so much for having me. I'm really excited to be here.
We're so excited to have you on and share what you do with our Social Life audience. I understand that you've been around for 5 years doing the beautiful work that you do. Can you explain to our audience who it is that you serve here in our community?
Yeah, so we started in 2015, and we were a group of individuals working with children with disabilities. And we just saw a need in our families to have more opportunities for engagement in the community, for social interaction, for our families to have opportunities to have fun outside of school and therapy, in an environment that was really adapted to their needs. And so we started in 2015 and started with sports and social events. And our ultimate goal is to really educate the community so that they open their arms to our kids with disabilities and start to learn ways that they can be more inclusive as well.
How many families do you serve across the valley? Because it is my understanding that you're serving from Star to all the way to Cameron County.
Yes, we currently have about 200 to 300 active families in our programs. And especially now that we're doing virtual events, we've been able to open up to even more families across the valley as they join us online and through activities that we send out to them at their homes.
How has that process, I can imagine it's been even more challenging with this crisis right now. How are you making this time a little more enjoyable for children living with disabilities, and not just more enjoyable, but safe in this time?
Right, so a lot of our families, their children have medical conditions that make them much more sensitive, so they are more likely to get very sick if they were to contract COVID. So they've been super isolated. They're not going anywhere. So it's been really important for us to be able to find ways to engage with them. We're using Zoom as a way to do fun activities. We had our big 5-year anniversary party this last Saturday. So what we did was we sent out 200 boxes to families across the valley that had party supplies. They had party hats and glow sticks and just things to engage while we had the entertainment going on during Zoom. And so the kids were able to see their friends, dance along and see their friends dancing along with them. And we had just such a positive response from the parents, and so many pictures of the kids with just the biggest smiles and grins on their faces. It had been like the highlight of their summer.
You made my heart smile right now, because there is no greater feeling than to see a child having a great time and being happy. Children being children, having a great time. If there's someone watching that would love to become a member of the Capable Kids Foundation family, where do they go, Ms. Watson?
So we have a website at www.ckrgv.org, and we also are very active on our Facebook page, which you can find by searching for Capable Kids Foundation on Facebook, and we're very responsive to messages there as well.
How can members of our community support the foundation through volunteering or through a donation? How can we support you to allow you to keep doing what you're doing?
Yeah, so the community support has been super important. During these, we send out the activity boxes, it was not cheap to put all these boxes together and send them out. And we had about 30 businesses and 80 individuals who all donated towards the boxes to make that a success. So As far as in-person volunteering, we're not doing any of our big events right now for the safety of our families, so donations help a lot. And if we do another box campaign, we would love to have more involvement from the members of the community to help with both the deliveries and the sponsorships as well.
Well, we sure hope that our community will answer this call to allow you to keep doing the beautiful work that you do in our community, serving these beautiful families. Thank you, Miss Melanie Watson with the Capable Kids Foundation. We appreciate your company today.
Absolutely. Thank you so much for having me on.
Be safe and best of luck to you.
Thank you.
And coming up, we're going to show you how to make a delicious Baja shrimp cocktail, Valley style, from our friends at Santa Fe Steakhouse. Don't go away, it's delicious.
McAllen feels different today. National emergency is changing everyday life in a place known for being social and open. But changing how we live doesn't change who we are, a community that makes the most of each day. We're still closely connected, even at a distance, working to make McAllen safer today and stronger tomorrow. Together, we'll look forward to the day when this emergency has passed and new reasons to celebrate begin. Until then, we'll make the most of McAllen.
A delicious way to add a little bit of spice to our summer, thanks to our friends at Santa Fe Steakhouse. We also want to thank Dr. Rao with DHR Health Institute for his time today, Miss Melanie Watson with the Capable Kids Foundation, Rabbi Nathan Farb for his message of unity, and Deutsch Deutsch. Especially you for making time for us. We can't wait to do it all over again. We leave you now with the art of socializing.